Hello, and welcome to the Consultation Skills course, Part 2. I'm Dr. Alex, and I work at the Christian Medical College in Vellore in South India. In our first presentation, we saw the benefits of good consultation skills. In this second presentation, we will look at what happens in a consultation. We will use the Calgary Cambridge Guide to the medical interview. The Calgary Cambridge Guide is an analysis of the medical consultation done by groups of academics, Suzanne Kurtz in Calgary in Canada, and Juliet Draper and Jonathan Silverman in Cambridge in the UK. It is a way of understanding and analysing what is going on at each stage of a consultation. It is not a model as such, but just a description of what happens in every consultation, good or bad. The Calgary Cambridge Guide recognises 5 phases in a consultation: initiating the session, gathering information, physical examination, explanation and planning, and closing the session. Running through the whole process are 2 themes: the healthcare professional providing structure to the interview and at the same time building relationship with the patient. So the first phase is initiating the session. The doctor or other healthcare professional greets the patient, introduces themselves and prepares to listen by asking an appropriate opening question to get the patient to tell their story. Having heard the patient's initial description, the healthcare professional also may check for anything else the patient wishes to discuss, apart from the first problem. The next phase, information gathering, is usually the longest phase of the encounter. The patient is encouraged to tell the story of why they have come to the clinic. The health professional clarifies what the patient has said, and then seeks more information on the patient's perspective on the problem, their feelings about it, and the effect on their life. The health professional will finish this phase by asking for any information they need. The health professional may summarise their understanding of the issues the patient is facing periodically, and inviting the patient to correct or clarify as required. Gathering information is followed by physical examination if it is needed. The health professional should explain what the examination will involve and what it is for, and seek the patient's consent. By the end of the examination, the health professional should have all, or almost all, the information they need to move into the next phase, explanation and planning. They will explain to the patient their current understanding of the problem using appropriate language, giving a diagnosis or differential diagnosis if possible. They will then explain to the patient the various options for what should happen next in terms of investigations or treatment if required. Then they should discuss with the patient what they, the patient, would like to do from the options laid out. After the explanation and planning, the health professional closes the session, checking the patient understands what to do, safety netting in case things go wrong, and saying goodbye. Throughout the encounter, the health professional works to provide structure to the interview so that the time is used effectively, and yet everything that needs to be done is done. And they also engage with the patient to build their relationship. A good relationship will help the patient explain the issues they face better and also help with concordance with the treatment plan. So, that is the outline of the Calgary Cambridge Guide to the Medical Interview. Under these 7 headings, the full guide outlines 71 so-called micro-skills, which a health professional may use within the consultation, although obviously no one consultation will ever use all of them. You can see the full list by clicking on the link in Moodle, or if you Google Calgary Cambridge Guide PDF, you will find it easily. We will use the Calgary Cambridge Guide throughout the course to learn how to work with patients at each stage of the consultation, and also to assess the quality of the consultation, both on video and in our own consultations. The next presentation will introduce us to the themes of power and control in the consultation. Thank you.